Hi everyone, I'm Nikki. Thank you so much for joining us. Today's session is actually the first episode of I'm Patient as a Doctor series. We'll be inviting doctors regularly to answer some questions that you may have relating to the chosen topic. Since we are celebrating Eye Care Awareness Month this October, this episode will be about eye care during COVID-19. I'm actually very excited for this topic because I think it's very relevant, especially now that everyone's always on their gadgets and are still finding ways to adjust to the new normal. With us today is Dr. Edward Uy, a renowned ophthalmologist, cornea, and external disease specialist with 18 years of experience in this field. Welcome, Dr. Uy. Thank you so much for joining us today. To start off, how are you coping with the pandemic so far, and how has this affected your practice?
Good afternoon. As you well know, the practice right now is a new normal for everyone. Unless it's an emergency, we don't usually see patients in the hospital. But as we go through the year, probably with the vaccine coming and everything, the safeguard protocols in the hospital, we will see more patients again.
That's actually what I've noticed as well. A lot of people are going online consultations and trying to avoid the hospitals as much as possible. Um, Again, going back to our topic today, they say the eyes are actually a window to your health. Many people are unaware how many systemic diseases like diabetes, MS, etc., can be detected through an eye exam. That's why a simple eye test can do more than assess our vision. Speaking of eye exams, how often should we get our eyes checked? Does the frequency depend on the age, doctor?
Yeah. So basically, we look at the history in the family. So error of refraction or like the need for spectacles is usually genetic. So if both parents have wear glasses on a daily basis, then probably you need to bring your children earlier to be examined. We tend to see like a grade in the eye like really early, 5, 6 years old. They usually need glasses already. So we want to maximize the full potential of vision. And in that aspect, we need to bring them to the doctor to make sure that they are attended to properly. So until the age of 18 to 21, usually the grade of the eyes will go up. So that's the normal tendency for growth. As you grow up, your eyes become elongated, and we tend to see that the grade will change routinely. After 21, usually the grade will stabilize and will change again at the age of 40. Aside from error of refraction, we see patients for conjunctivitis, like any irritation in the eye, people who needs consult for diabetes, any genetic like problems like glaucoma, cataracts. So uh, as for age 21 and below, probably you need to see your doctor like every year. But
Yeah.
for patients 21 and up, on an as needed basis, depending on the need for a consult.
Yeah, thank you, doctor. I'm actually learning a lot. I'm not so sure if my parents actually brought me to the doctor early on, but I'll keep that in mind. And better to have yourself checked first for any genetic diseases before, and also continue with if you see any problems or any diseases that you might encounter along the way. So another follow-up question around that. A lot of us are actually curious. How do you actually know which eye doctor to see? A while ago, we mentioned your credentials. You're a cornea and external disease specialist. You're also like, a general ophthalmologist. Um, for millennials like me who just like wear glasses, will the frequency of checkups also change? So who should I go to, and will it change if I'm just a normal person wearing glasses? Will it increase the number of frequency of going to the ophthalmologist?
Yeah. You can see general ophthalmologist, or what we call a comprehensive ophthalmologist. So these individuals will have like specialty subspecialties if they want to like train more, and we inter-refer if we need to refer. But basically, a normal ophthalmologist can do a basic eye exam and address whatever problems you have, unless it's something more meticulous that you need a specialist to like really see.
Like for example, surgery or something, are all doctors usually prone to, having an eye surgery daily in their hospitals?
Yeah, the surgery comes with age. So a normal general ophthalmologist can do routine surgeries, but for certain diseases like retinal detachment or the need for a corneal transplant, then probably a specialist will be a better like doctor to see. But your doctor can like inter-refer if
Mhm.
you will need such a consult.
Yeah. So again, it depends maybe what your condition is, and
Correct.
um, a general ophthalmologist, safe to go to them, and then they'll refer you to somebody else. Again, doctor, on the question for will the frequency actually change if I'm wearing glasses or contact lenses? Will it be more regular, or is it just the same as the first one?
Yeah. So regardless if you wear the glasses or not, the grade will increase. So that's something that you can't control with spectacles or contact lenses. So the need for seeing the doctor is to keep you updated. Like for a child to normally function in school, you need to make sure that the grade is correct, or else there will be like problems with studying, with reading and all. It will be more difficult for the child to function unless the child can really see 20/20 perfectly with the spectacle.
Okay. Thank you for answering the general questions, doctor. Now we wanted to make it more relevant to what we're experiencing now. So with COVID-19 making it difficult and risky for people to go to hospitals to consult doctors face to face, many people have actually turned to virtual consultation. So Dr. Uy, when would you recommend a virtual consultation, and what is considered an eye emergency that they really have to go to the
Uh, yeah, so for eye emergencies, we need like face-to-face consult. So it's impossible to address the problem through online consults. With online consults, probably the simple eye redness, eye irritation can be addressed, but other than that, you need the face-to-face consult.
hospital? So usually when there's a procedure done on, or when you're assessed virtually and you need more assessment face to face,
Yeah.
you actually go to the hospital. You've mentioned around like certain symptoms are around like redness or irritation. So another follow up question there, doctor, is there a way we can self check our eyes at home? Are there any, for example, more symptoms that you can identify, or signs that we have to watch for?
So aside from blurring of vision, which is the probably one of the main reason why you see an ophthalmologist, any eye irritation, eye redness can also be symptoms of or reasons for you to see the doctor. Having a history, like your parents can advise you on that, of any eye diseases in the family is another reason for you to see your doctor. Sometimes it's really hard to like diagnose yourself without seeing the doctor and having some exams done. So the history is important. Aside from the signs and symptoms that the person will complain about.
Okay. But if there's something wrong, best to consult a specialist, specifically where you're hurting, right? So for you guys
Yeah.
out there, there's nothing wrong with seeing anyone virtual, even a virtual consultation will do, and then proceed from there. Um, So aside from that, we know that COVID spreads through droplets and it can be transmitted through the eyes.
Mhm.
I think it's one of the new information that they've been saying because before people were just conscious about putting a mask on, for example, but now they have a face shield. So how about those types of like assistive eye correction, such as contact lenses? Does that actually increase the risk of contracting the virus?
For contact lenses, to start with, you usually need to be responsible before you start wearing contact lenses. So a person who wears contact lenses would know that it's important for you to like really take care of the storage,
Mhm.
the cleaning, and to replace them if you need to replace them. So these are important things that you have to understand. So with in this time of COVID, we need to be extra careful because we don't want to have an infection through the tears. But unless you're really exposed and you're really rubbing your eye, it's really hard to like really validate that this person had the infection through that. So it's more of the um, the the nose and the throat being the real transmission. But there are like papers being written down that you can also transmit it through the tears.
Okay, that's actually really helpful because I used to wear contact lenses and I always remember that I had to be really careful, wash my hands before, after, putting it on my eye. But with the new pandemic, I think we really just have to be more careful around that. Okay, I just wanna maximize you being here as an eye surgeon. So another question we got is it safe to undergo LASIK surgery during this time, or would you recommend for people to hold it off for now?
So it depends on how you really need it at this particular time. We don't want to advise patient to wait unless they really don't need the correction right now. If you look at like the uh, pattern of cases in Manila, there's been a drop in the number of cases. If the center where you want to have the treatment and your doctor assures you that the treatment is safe, I don't see the reason why you shouldn't do it now. So the later you decide to have the correction, the later you enjoy the benefit of being spectacle free. So I don't think it should stop us from having any treatment at this particular time, so long as you're screened properly and you're going to certain hospitals or centers that are safe.
Mhm. And nowadays, I think some clinics are actually really showing how they practice, um, you know, having a COVID-free environment in their clinic. So it's good to research first before you're going, and of course, like ask your doctor, about the pre-requirements for that one before going. So another question we have here for you, Doctor, is with a lot of us working from home, do you have any advice on how to reduce eye strain from looking at the screen all day? I think you get this question a lot.
Yeah, correct. So it's like watching television. You can't do that like 24/7. Exercising, you can't like exercise the whole day. So we have muscles in the eye that will fatigue. So the longer you use them, the easier or the faster your eyes will fatigue. The moment your eyes fatigue, then it will be difficult for you to focus. Things will be blurry, and it will be more difficult for you to function normally. So we just need to make sure that we take pauses in between. Like if you're doing like computer work and it's something that you need to do, take pauses like every 30 minutes. You stop and you focus far, like 20 feet away for about 20 seconds. So focusing far will make your muscles relax. So it will help you focus and for you to perform like finish whatever you need to do like faster also.
Well, we have to be reminded of that every day since a lot of us have been working from home. And doctor, you said something around having 30 seconds of breaks in between. But in terms of the entire duration of being on screen in a day, what would you recommend? Like in terms of hours, is there any recommendation?
Uh, yeah, it's difficult to like really limit someone whose job like pertains to like computer work. So we have to get by with whatever we need to do. But we have like that rest for your muscles to relax. At the same time, we can use also lubricant drops that helps with the dryness factor, especially if you're in front of the computer for a prolonged period of time.
Yeah.
Your blinking process is affected, so you don't blink as normally. Plus, focusing is longer. Plus, you have the air conditioning that also contributes to the dryness effect on your eye. So, but for us to like really put a number with regards to the number of hours, it's difficult because it's case to case. Not everyone will have the luxury of like not using the computer longer than 2 hours. So we just need to understand that if you feel like fatigued or you can't focus properly or you feel the symptoms of dryness, then it's okay to stop
Yeah.
and to rest for a while.
Yeah. So what I got from there is, it's actually, wiser to tell people to have pauses versus limit them altogether. It's because it
Correct.
really depends on their, occupation or how much they're needed on the screen. So, aside from your tips earlier, Doc, a lot of people are also changing their lifestyles to improve their health in general. So, for eyes in particular, what can we add to our diet to help our eyes perform better? This aside from the diet or what we eat, the sleep duration affect our eye health as well?
Okay, so a healthy diet is important. Proper hydration. We need to take like vegetables, which is something that we often neglect. Anything that has vitamin A, lutein, green leafy vegetables like uh, cabbage, broccoli, spinach. Those are important factors that we important food that we need to put into our body to help with our vision. For certain individuals who really can't take that much like vegetables, we have supplements available. These are something that we like prescribe to patients who are diabetic, hypertensive, which I think these patients would need it more to protect the retina. With regards to lifestyle, like I think we talked about that already. We just need to like make sure that we lubricate our eye if our eyes are dry, protect our eyes from UV radiation, sunlight. We don't need protection for the blue ray of the like the gadgets. That's something that is not supplemented by uh, theory. Those are just theoretical and not like proven by any like studies.
Yeah.
So yeah,
So thank you, Doctor. Thank you again for your time, and we really appreciate you sharing your tips and answering a few questions from our viewers. So before I end, any last words before we end our consultation with you today?
yeah. I just want to tell everyone that it's safe to see your doctor. Don't hesitate to get in touch with them for any like eye problem. So long as you protect yourself with a mask and your doctor practices in a very safe hospital or center, there's nothing to be worried about.
Thank you, Dr. Oy, again. And thank you, viewers, for listening in. I'm confident that a lot of our viewers can definitely take a thing or two from today's session. Before we end, we'd like to invite everyone to register on Impatient by going to www.impatient.ph. For those who want to consult with Dr. Oy, our guest today, you may find his profile on Impatient. So thank you. Once again, this is Nikki Calixto, your host for this month's Ask a Doctor episode. Book your appointment through Impatient. No more waiting.